Hey guys, it's Hink here. I wanted to bring you all another video today. So for those that don't know me, I actually am a real life physician, hence all this get up to try to protect myself a little bit. But there is a question that always comes up. And so I came onto the PE scene about 2 years ago, and a recurring theme is, why don't more doctors recognize PE? And so that's what I wanted to address today, because there are multiple different reasons why nobody addresses it. So if you want to see more about what I post, what I do, I'm very active on Reddit for the most part, that's at Getting Bigger, and my username is Hinkle McCringleberry. And so let's jump right into it. So why don't doctors actually endorse or believe in PE? So the first reason is that the majority of people that want to get bigger are actually within a normal range. And there's actually a published paper that you can look up if you don't believe me. And the title of the paper is it ethical to perform penis enlargement surgery on somebody with a normal sized penis? And so there's a lot of ethicality that you have to keep in mind when people are potentially partaking in a dangerous exercise when they have a normal sized penis. And so instead of looking at enlargement, what is often recommended is that there's therapy, counseling, an understanding of actual metrics, what is normal, what is not normal. And so that is really the first kind of pitfall right there, is the ethicality of it, doing something that's potentially dangerous, whether that be actually PE or it be actual surgery, whether you should consider that. And so the next pitfall is there's no published data, or there's no good data. And that's kind of true. So when you think about the medical profession, and so, I've been a doctor for quite a long time, and there's a gold standard on what you look for, which is basically randomized controlled trial, looking at two different variables when you have basically blinded trials where the observer doesn't know which is which, and you can have a measurable benefit that is without a doubt conclusive. And that is what we look for in the medical community. And then there's other things like prospective trials, and underneath that retrospective trials, and underneath that there's basically like cohort data, and ultimately there's case reports that are under that as far as the level of evidence. And when you actually look at PE, there are actually some pretty decently done trials, if you can find them. There are some problems though. A lot of them are actually sponsored by the device that's being used. And so there's going to be some inherent bias when you're running a trial, when the benefit is of the people running the trial. But then there's also, they're just poorly run in the sense that you can't just get a otherwise natural healthy male to say, hey, we're going to run a penis enlargement trial, which I'll kind of get into in the next step. And so instead of looking at normal people, it tends to be these studies done in people that have things like small penis syndrome, or clinically small penis, or especially those with like something like Peyronie's disease, where using something like an extender or a vacuum device could actually potentially help correct the disease. And so there is a limited patient population that is being examined in the trials that we do have. And I'll be honest, most providers and most stupid people on the internet, that's not fair to say stupid, but most ignorant people on the benefit aren't aware that there actually is published data. And I am going to get to that video. I'm just trying to decide exactly how I want to do it. But there's actually, if you go on PubMed and look up penis enlargement, you can actually find quite a few published trials showing that there actually is a measurable benefit. And so even there is a urologist, and I'll try to see if I can link up a screenshot of her name, but she actually talks about the trial, a real life urologist that says actually extenders work to enlarge the penis. And so it's not that there is necessarily a true paucity of data, it's just that most people aren't aware of it. And so when you're talking about why isn't there better data, well, you have to understand how complicated it is to run a true clinical trial. And so first of all, you have to kind of brainstorm how you're going to get funding for a trial. Depending on the size and the extent, these trials can actually take millions of dollars, and not only in the sense of just like the dollar amount, but you have to have people that can actually, you have to have a statistician, you have to have somebody to collect the data, somebody to process it, and then you have several authors. And all of that takes resources to kind of compensate these people for their time. And so it's going to be hard to get a clinical trial funded. And then there's also these major pitfalls, like there's something called the IRB, the Institutional Review Board. And what this is, it's this group of people that came together to make sure that any clinical trial run is going to be ethical, okay? So let's say that I wanted to run Hink's clinical trial on penis enlargement, natural methods for penis enlargement. And I would, write to all up my proposal, and then I would submit it to the Institutional Review Board, and they're going to say, so like, you want to pursue some potentially dangerous technique in people that don't have an issue just for the benefit of personal enlargement? That's going to get stricken down every single time. And so the trial is actually not going to get past the IRB in a normal male. That's why you have to go through things like through Peyronie's disease or through like small penis syndrome to actually get these things funded. And so, that's just limiting the data. Is like, oh, well, there's no data. It's like, yeah, because nobody's going to approve this because nobody really believes it works. And so it's kind of like this chicken and the egg thing. And I think really the biggest and most important point is that this is dangerous, guys. I've kind of made my niche with, injury counseling, and especially on Reddit, people often reach out to me to the point where I actually have to make a Patreon, which I'll include a little link. It's just DocHink, DocHink is the /, but to try to coach these people because, it's not infrequent that there's some kind of injury that occurs. For me, myself, I've been doing this for almost 2 years, and I've had multiple pelvic floor injuries. Thank God they've been temporary, and even some recurring issues with lymphatic issues. And so, and I went to the doctor when I first had my lymphatic issues, and, he thought I was excessively masturbating, and it was kind of awkward. But anyways, so this is dangerous. So if I was a doctor and the only time I would see patients and my only experience with penis enlargement is when people came into the emergency room thinking that they broke their dick, I would not recommend penis enlargement with the paucity of data supporting it, and then me only seeing people that have that are injured. I would absolutely not recommend it. And I make sure to tell people, that's my whole thing, is I'm trying to promote PE or penis enlargement and showing people that yes, it is real, and yes, it can be done safely, but you have to do things to mitigate the dangers, like supplementing with citrulline, like adding microdoses of Viagra or Cialis to improve blood flow. And so that's the big thing, is that it's dangerous. And so this goes back to the ethicality thing. Is it ethical to try to pursue something or promote something when there is the danger of, potentially permanent erectile dysfunction, which has been done? Because this field is so limited, there is people that still recommend jelqing, which, BD made a good video on why you shouldn't jelq. There's some, minor nitpicky things that I don't even care to address, but in general, yeah, he makes very good points, and, several of the points that I've included a lot on my Reddit posts, which I have a full database on Reddit that has, different posts that I've made addressing injuries, injury prevention, medication, supplementation, all of that. So if you actually go onto the internet and, fact check me on this and type in penis enlargement and then go to like Mayo Clinic or go to WebMD, they actually say on these things that yes, actually PE works. They say, yes, there is data showing that it can improve penis length up to 2 inches in some reports. However, it's very dangerous and you have to be very careful. And there's things like overpumping that can lead to fibrosis. They mention all of these dangers associated with it. And so it's really the danger thing that is limiting this being mainstream from a medical perspective, because there is risk associated with it and not enough benefit to override that. And I think a lot of doctors think that, even in many of these articles that I researched for this, they just allude to jelqing, like that's the only PE technique. And in a lot of ways, I think that this is like that skit in Family Guy where Peter ties his dick to a car and then gets the car to drive off, and then it has penis enlargement. I think that's what the mainstream medicine thinks that penis enlargement is, because they really don't have any idea of the nuance and the different techniques, and like I said, the ways to mitigate safety. And so The danger is, I think, the biggest rate limiting step in getting this more mainstreamed. The other thing is that pills and creams get lumped into penis enlargement, and obviously those are absolute horseshit. I'm not gonna lie, I tried multiple different penis enlargement pills that are guaranteed to give me 4 inches in 4 months or whatever, but that all gets lumped into non-surgical penis enlargement, and that is why that people say penis enlargement doesn't work, because it's associated with these, clear scams and clear hoaxes. And I'll tell you that also, once again, I'm a doctor. I don't care if you believe me or not. I'm board certified here in the U.S. I work here in the U.S. in a hospital. I'm in the conference room right now. But throughout anatomy, learning about the penis and the urologic systems, of course, penis enlargement was never mentioned. Even in our classes, when we're talking about the physiology, how the penis works, the most training we got was a brief mention of average penis sizes. So of course, penis enlargement isn't being taught in medical schools. And to go any step further, I actually did multiple urology rotations because I was very interested in urology and I was considering going into it. And so, and never once did it even come up. And I would say I probably spent over 6 months on a urology service, and never once was penis enlargement from natural techniques discussed. There are things like when people have nerve damage and actually have to get an implanted implant where you can actually, circumvent different neurologic disorders or different ways, different erectile dysfunction disorders. But never once was it like, hey, what do you think about penis pumping outside of if you have some sort of prostate cancer or some sort of surgery like that? Pumping has been proven to actually improve penile flow, which it also is proven to improve penis length on a different Peyronie's disease trial, but that's neither here nor there. That's coming up later. So it's just not taught. And then the last point I'd like to bring up is just that urology associations, whatever the governing body of urology, at the end of the day, they're going to get paid to actually do penis enlargement surgeries. And even some of these, clinics that are doing penis fillers or PRP, that is all money into them. And so they have no incentive to make statements showing the efficacy and safety of natural penis enlargement techniques that you can do in the safety of your own home, because they're not going to get paid on it. And so this is kind of big urology. But I do think there's absolutely truth to that there's no benefit for urology clinics to actually run trials to show that PE is actually safe and effective. And so that's basically it in a nutshell. Trying to make this a shorter video. If you enjoyed the video, please like and subscribe. I'm trying to grow my channel, spread the good word, reach some people, help people learn how to do PE and do it safely. If you specifically need injury coaching, you can go to my Patreon. Otherwise, do your own research, form your own conclusions. Hopefully this was helpful. See you on the next one.